funeral pyres in car parks and patients being treated on the ground outside hospitals. Images like these have become synonymous with India's disastrously inadequate Covid-19 response. But this isn't India, it's Nepal. And the crisis in the Himalayan nation is getting worse by the day.
Our emergency room had 5 beds. We've added another 20, but the situation is so difficult. Doctors are working very hard. They're on duty for 24 hours a day.
But it's not enough. Nepal shares a border with one of India's worst-hit provinces, Uttar Pradesh. 2 weeks after the second wave began ravaging northern India, Nepal's Red Cross reported a similar rise in infections. What's happening in India right now is a horrifying preview of Nepal's future, the Society's chairperson said in a statement. During the first week of April, Nepal was recording about 200 new Covid-19 cases each day. A month later, that daily average had soared to more than 6,700. That's a mind-boggling increase of over 3,000%. Nepal is much poorer than India, so the implications are likely to be far worse.
There is a lack of awareness about precautionary measures such as maintaining physical distance, using masks and sanitizers. This information has been broadcast over television and radio, but some people here have never seen a television in their lives.
Nepal had been relying on its neighbour for vaccines, but now they're in short supply. In October, Prime Minister Narendra Modi said India would be the pharmacy of the world. In January, it began rolling out what it called a vaccine friendship mission. 66.5 million doses of the Indian-made AstraZeneca shots were distributed to 95 countries.
Despite all the challenges, this time we have greater experience, better resources and a vaccine as compared to last year.
But come March, as the second wave began to swamp India's healthcare system, the government banned all vaccine exports. By the end of April, Indian inoculation centres had closed because they'd run out of jabs. International governments are suing India's Serum Institute for failing to fill orders. In an interview with the Financial Times newspaper, the company's CEO has warned the shortage will persist for months because, he says, the Modi government has failed to adequately prepare for the second wave. He said, if we don't see a major shift in 2-3 months, then I think we're going to have some trouble. In the meantime, the crisis is deepening.
A phase 3 is inevitable, given the high levels of circulating virus. But it's not clear on what time scale this phase 3 will occur.
And that means India's neighbours will also need to prepare for the worst. Melinda Nucifora, TRT World.